It was 3 years ago this week when we first reported on Colorado hospitals preparing for the possibility of people infected with COVID-19 coming to the U.S. from China.
So we need to be diligent in keeping those individuals contained and limiting further exposure. And we would do the same thing if a case presented here.
Little did we know how the disease would soon explode around the world. 6.7 million deaths later, health experts expand on the latest World Health Organization finding.
It's still a public health threat because we haven't done these things that everyone is saying we need to do.
Infectious disease expert Dr. Josh Barocas with the University of Colorado School of Medicine co-authored this recent study published in the journal Nature, which lays out 57 recommendations for ending the COVID-19 pandemic. Among them,
if we're not protecting our most vulnerable people, then no one is protected, essentially.
The study calls for addressing inequities like access to health insurance, vaccines, and childcare, the ability of only some to work from home.
We can't expect people to choose between life and livelihood.
It's critical, Barocas and others say, to communicate clearly with the public about actions that need to be taken. Try to get all parts of society on the same page.
We've done a bad job at using public health as a verb, that it's an ongoing process, that it's fluid, that it's dynamic, and that it has to change.
The study was led by the Barcelona Institute for Global Health and involved 386 multidisciplinary experts from more than 100 different countries.
Actually, what surprised me was the level of agreement. For example, the fact that we shouldn't rely only on vaccines. All the experts agreed, basically.
Co-author Jose Luis Jimenez of the University of Colorado, an aerosol scientist, says there was wide agreement that COVID-19 is primarily transmitted through the air like smoke, not through respiratory droplets or common surfaces. High-quality masks and proper ventilation are key.
Science influences policy, so this is a way to put the science out there in a very clear form.
Combating COVID-19 misinformation will help science to triumph over politics and division. Another recommendation that may be harder to achieve.
We haven't done nearly enough. We have not put in place nearly enough of the protections to prevent this from happening again.
Barocas says much has been learned over the past 3 years, but much more needs to be done to improve pandemic response. He hopes the study will help.
It moves the needle a little bit in the right direction.
Hendrik, Sybrandy, CGTN, Denver.